Thank you for listening to Depictions Media Radio.
On June the 18th of this year, I received notification of serious allegations of racist practices in an emergency room or rooms in BC, whereby staff were guessing the blood alcohol levels of patients as a type of game. On June 19th, I appointed Dr. Mary Ellen Turpel-Lafont to investigate the allegations, determine the facts, and to recommend actions to make our public healthcare system a safe place for every person in BC who seeks its care. To that end, the scope of the independent investigation included a comprehensive review of Indigenous-specific racism in the BC healthcare system. Dr. Turpel-Lafont has shared with me her recommendations and report, and we are here today to share with you all the outcomes of this report. It is my honor to introduce to you Dr. Turpel-Lafont, who will walk us through the findings of her report.
Good morning, everyone. First of all, I'd like to thank Minister Dix for the introduction and for being here today to receive this report. I too would like to begin by acknowledging that we are on the territory of the Lekwungen-speaking people and to recognize and thank the Songhees and Esquimalt First Nations for sharing their territory with us. I'd also like to acknowledge that there are a number of First Nations chiefs and leaders and Métis leaders and supporters who wanted to be here for the release of this report and who have been actively involved in ensuring that all of the information needed to prepare this report was made available to me. Because of the COVID-19 restrictions, they're not able to be here in person, but I certainly want to say to them that I feel strongly their presence today, even though they were not able to be physically here with us. In addition, before I begin to discuss the details of the report, I would like to offer a gentle warning to Indigenous people watching, listening, or reading the report that this report includes topics that may trigger memories of your own culturally unsafe personal experiences, those of your friends, family, and community. If you require emotional support in dealing with this information, we have provided support numbers for services that are available to engage with you to address trauma that you may experience in processing the information in the report. As Minister Dix indicated, in June of this year, I was appointed by him to conduct an independent review into some specific and highly disturbing allegations of racism in British Columbia emergency rooms, and to take a wider look at whether anti-Indigenous discrimination exists in the provincial healthcare system as a whole. I assembled a small team with expertise required to do the job, and we've been very busy since then. I'd like to thank and acknowledge the team that supported me with this work. As you know, the allegation was that there is an organized Price is Right game involving guessing the blood alcohol levels of Indigenous people in BC emergency rooms. Our detailed examination of those allegations found no evidence of an organized game as originally depicted, namely with prizes and locating and occurring throughout emergency rooms across British Columbia. What I did find was anecdotal and episodic evidence of multiple activities that resemble those allegations, but not as a game with that name, not as widespread as alleged, and in places not just targeting Indigenous people and Indigenous patients. However, and this is a very significant however, our review that I'm releasing today, both the long report and short report that's available to you, found much more widespread and insidious problem, meaning if there had been simply a game played away from patients, as difficult as that would have been to make that finding, what I found, in fact, was at the point of care, there is direct pressure, touching, who seeks care at the point of care will experience racism today. It just means that any Indigenous person could face it because it is that pervasive and entrenched in the system. We should all find that conclusion deeply troubling, and I want to take a few minutes to tell you how we reached that conclusion. Our review collected the voices of nearly 9,000 Indigenous patients, family members, third-party witnesses, healthcare workers. We had 2 online surveys that we initiated. And you will note in the report, in the long report on page 30, you can see the graphic of what we heard and what the report is based on, or in the short report on page 15, it has the same. And the voices of the people we heard from include, for instance, today I was connecting with an 86-year-old First Nation elder who actually took the time to complete the survey. And I'm so thankful for the fact that Indigenous people particularly were keen to engage and to explain in detail what their experiences had been and say that they were so appreciative of finally having an opportunity to come forward and talk about it in a safe way. We also had direct submissions from 600 people who shared their detailed experiences of either being victims of discrimination, racism, or prejudice, or as healthcare workers observing it directly in their workplace. We examined health utilization and outcomes of approximately 185,000 First Nations and Métis patients and did an unprecedented examination of data to inform our findings. The 2 reports that are out today will be followed up within the next month with a detailed data report, which will dive more deeply into those conclusions. We conducted more than 150 interviews with staff and key informants who work in the system. We examined more than 700 health authority and regulatory college documents, conducted extensive literature review, and had multiple submissions from healthcare and community groups and organizations. Examining all of this evidence, we found pervasive interpersonal systemic racism that adversely affects not just patient and family experiences, but also long-term health outcomes for Indigenous people in BC. I'll give you some examples of the things we heard. 84% of Indigenous people who engaged with us through the survey said that they experienced discrimination based on their identity, race, or ancestry while accessing health care. Only 16% of Indigenous people reported never having experienced direct personal discrimination at the point of care. However, it's noted that they may too have experienced systemic barriers, obstacles, and different outcomes than other British Columbians. More than 1/3 of the thousands of non-Indigenous people who took our healthcare worker survey reported witnessing interpersonal racism or discrimination against Indigenous patients and families and friends at the point of care. Indigenous people consistently told us, and this was confirmed by the healthcare workers who responded and the cases, that they are subject to negative assumptions based on prejudice, based on racism, based on beliefs that should not exist in our healthcare system. Among the top negative assumptions that are circulating in our healthcare system today is the idea that Indigenous patients and people are less worthy, that they're alcoholics, that they're drug seeking, that we're bad parents, frequent flyers, non-compliant, and incapable of adhering to treatment and medical advice. Those are biases and prejudices that are active in our healthcare system. Often these kinds of stereotypes and prejudices lead to poor care at the point of service. And what I find in detail in the report today is what does that type of stereotyping result in? What kind of discrimination? What does it look like in our BC healthcare system? Well, what it looks like are the following. It looks like abusive interactions at the point of care. That can be verbal and physical abuse. It results in denial and delay of service. It results in ignoring and shunning, inappropriate pain management, medical mistakes because people do not see what the patient and hear what the patient is saying and suggesting is the issue, and a disdain by some healthcare workers for cultural protocols and First Nations and Métis traditional healing practices. As I noted, I'll be releasing a separate data report to address a number of these particular issues, but our data review shows that racism limits access to medical treatment and negatively affects the health and wellness of Indigenous people. And I need to note that we found with all of the data and information that came forward in this review that Indigenous women are disproportionately impacted by racism in healthcare, and racism in healthcare contributes to them being even more harshly impacted by the current pandemic and the opioid overdose crisis. And Indigenous people are more harmed at this time by these twin and serious epidemics and crises that we're dealing with. In terms of looking at the complaints process, I did look at all of the complaints that have been submitted by Indigenous people to regulatory colleges and health authorities. We looked at all of the issues that had surfaced in the Sanyas Indigenous Cultural Safety Program, and we looked more broadly at health system utilization data, meaning how often are Indigenous peoples receiving primary care, what do they present at an emergency room for, how are they treated when they get there, how are they treated in hospital, how do they access things like cancer screening, are they having the same degree of access and support as other British Columbians. And on every one of these areas, we found differential treatment for Indigenous people. In terms of health condition prevalence, acute and chronic disease in British Columbia, we found that Indigenous peoples are disproportionately suffering on that front. In terms of all health outcomes, we found significant differences, and differences impacted by prejudice and discrimination that begins a cycle that's reported on in quite a bit of detail in the report, and you will see a graphic that describes that in the short report at page 15, in the long report at page 15 and in the short report at page 18. What all of this information led us to conclude is that we have a major problem with Indigenous specific racism and prejudice in BC healthcare. Yes, the problem is rooted in long-standing entrenched practices that have negatively treated Indigenous people, such as colonialism, residential schools, being in segregated Indian hospitals, being taken out of the mainstream system and put into a substandard system for a long time. And this has never been thoroughly examined, so I'd like to acknowledge and thank Minister Dix and the government of British Columbia for inviting this examination, as I believe this is the first evaluation that has been done in Canada in such a systemic way of how Indigenous people experience racism, how it affects the treatment they receive, and the outcomes that we need to address as a society to have a more equal and fair healthcare system with a better quality of life for all people. In terms of the recommendations, you'll see that the report has 24 recommendations. I'm not going to go into all the list here. They're included in the reports that are released today. Taken together, I believe they create a blueprint for rooting out racism and discrimination and ensuring that the human rights of Indigenous people to respect, dignity, and equitable healthcare are upheld. I just want to be very clear that there should be no mistake made about this report. It is essential in British Columbia that everyone in the healthcare system must eliminate all forms of racism and discrimination against Indigenous people and must all pull together to ensure that that is done. The 24 recommendations look at three things that I think are important, or three domains of this discrimination and racism. And that is the need to change the beliefs that have allowed this to continue, including the beliefs and learning that our health professionals have. We need to change behaviors in terms of having greater degree of accountability in the system for when racism is identified, that it can be addressed, and that the concept of healthcare quality includes receiving healthcare that is not discriminatory, that is free from all forms of racism toward Indigenous people, and recommendations about system reform. And to be clear that at this point, I'm not confident that we have a systemic approach to tackling racism against Indigenous people in BC. I can say, though, that it's important that the government of British Columbia and Minister Dix sets a tone for how we respond to this at the point of care. And I would note that the work that was done to evaluate this was very much assisted by the fact that a year ago, British Columbia adopted the Declaration on the Rights of Indigenous Peoples Act. And so in the past year, there's been greater understanding of provisions of the UN Declaration, such as Article 24, that talk about Indigenous people having the right to access health care free from discrimination. The shifts that were made a year ago are starting to come down into the healthcare system, and I can see that with this report and review. There's a greater degree of openness and willingness to shift at the point of care in all the various partners in the healthcare system, but it is ripe to make those changes. Some of the major issues I'm calling upon Minister Dix to consider with partners from the First Nations leadership and community, First Nations Health Authority, First Nations Health Council, and Métis Nation of BC, are create a new BC Indigenous Health Officer, a BC Indigenous Health Representative and Advocate that can ensure the complaints and concerns of Indigenous people are processed through the quality review process and are heard. And I'm recommending an Associate Deputy Minister of Indigenous Health. These are just a few issues, but they will provide much needed leadership to assist Minister Dix, assist the health system more generally to go forward. I'm also recommending some innovation in education, like the consideration of a joint degree program in medicine and Indigenous medicine, so there can be more respect paid for Indigenous knowledge and a higher value placed on the work that is needed to respectfully engage and ensure that Indigenous people are providing service in the healthcare system at all places and service that reflects their experience, as well as the mainstream medical training program. It's very important that the province continue efforts to strengthen employee speak-up culture, and this is something that the Provincial Ombudsman has reported on before, and in the province of British Columbia in December 2019, the Public Interest Disclosure Act came into force. It's very important that that Public Interest Disclosure Act apply without further delay to the healthcare sector. And I say that because in the context of this review, having engaged with many people directly in the system, their fear of bringing things forward, their lack of understanding of what the pathway is to bring things forward is not helpful to address the racism. It's not helpful for workers in the system. It's not helpful for patients. So I would like to see the government apply the Public Interest Disclosure Act to healthcare employees without further delays. In concluding, I would just say that I've met with Minister Dix. He's provided an assurance to me that his ministry and government will look at these recommendations. And I want to take a minute again just at the end to say how grateful I am for the opportunity to do this work. I've had unprecedented cooperation by everyone in the healthcare system. I had no barriers to accessing information in this extensive review and at sometimes investigation of issues, and I'm so grateful for that. And I particularly want to thank the many Indigenous organizations, peoples, and leaders who have participated, and thank the First Nations Health Authority for providing therapeutic support through the line and the number for people who have been triggered and have had mental health trauma by this report, and the Métis Nation of BC who have likewise done so. So I believe that Indigenous peoples will have their voices heard and amplified today, and I think that's important for today. And I think I hope very much that this will be more than just one day today, that this will begin a process of significant change in British Columbia that can mean at the point of care, cultural safety, respect, and the elimination of all forms of discrimination against Indigenous people will be realized. Thank you.
Thank you very much, Dr. Turpel-Lafont, Mary Ellen, for this extraordinary work. I think this report, the fact that it was done so expeditiously, given its substance and the extraordinary response from people, will have an enormous impact in BC, I believe across Canada and elsewhere, as we deal collectively with these very difficult issues. The report in plain sight shows racism at an individual and systemic level. Racism that has made the BC's healthcare system an unsafe place for many Indigenous people to access services and the care they need. Racism affects health outcomes, a fact that is clear in the testimony and detailed statistical evidence in the report. On page 35, for example, you'll find an Indigenous doctor's account of how they had refused to go seek treatment at hospital as a patient because they feared the racist and discriminatory treatment they'd received. Or on page 29, Indigenous women left a specialty hospital against medical advice at a rate 11 times higher than other residents. Or the report's survey of responses, thousands of responses, which concludes amongst the survey participants that 84% of Indigenous patients experience racism in the healthcare system, and 52% of Indigenous healthcare practitioners face racial prejudice. Racism is toxic for people, and it's toxic for care. I want to make an unequivocal apology as the Minister of Health to those who have experienced racism in accessing healthcare services in British Columbia now and in the past. I want to sincerely thank all those who participated for reaching out to tell us of your experiences. Hospitals and clinics must be places of trust and comfort, and all of us should have confidence that without a doubt we will receive the respectful care that we all deserve. My apology today is an acknowledgement of the pain that Indigenous people have borne from racism. It is a first step, however. I will recommend to the Premier to sit down immediately to work out our government's response to meet the report's first recommendation and set us on a path to healing and reconciliation. This will be planned alongside First Nations and Métis partners. When I learned of allegations that there was a game being played in an emergency room to guess the blood alcohol level of patients, we set out to find and follow the facts of the investigation. And Dr. Turpel-Lafont and her team did just that. The facts of Dr. Turpel-Lafont's investigation did not lead us to evidence of a game occurring in BC's hospitals as originally depicted. It did lead us to the certainty that stereotyping, racism, and discrimination exists in our BC healthcare system. Systemic racism exists, it persists in our healthcare system, and it is damaging to the health and wellness of Indigenous people in our province, and in fact, I'd argue, to all people in our province. I want to say to you today that I'm 100% committed to making sure the healthcare system here in BC is providing safe, high-quality, accessible, and culturally safe care for all peoples in BC, and it is my determination that racism will have no place here. I'm committed to working hard on all of the changes outlined in this report, and I'm committed to doing that in partnership with Indigenous health and community leaders. I want to ensure that the structural and systemic changes that are recommended make a real and meaningful difference for any Indigenous individual who needs and seeks health services. As Dr. Turpel-Lafont said, the point of care is essential here. The Ministry of Health will work very closely with our First Nations health governance partners and Métis leadership to make positive change. As immediate steps, 5 new Indigenous health liaison positions are being added in each health authority, and I have directed the Ministry to review medical staff bylaws to implement consistent standards for cultural safety and humility as an expectation for medical staff privileges. It is important to emphasize, as in the report, that these recommendations build on the work, the commitments, and efforts of staff across the healthcare system to improve care for Indigenous people. But we all need to recognize and recommit to eradicating racism from our health system, to ensure that our beliefs and behaviors are anti-racist and based in cultural humility. The release of this report is not to blame or shame the people who have chosen a field of service in healthcare, but it is a call for us to actively do more as individuals and as a system. The situation as it exists and as is depicted in the details of this report cannot stand. This report does give us, the provincial health system, the opportunity to accelerate a comprehensive approach to address long-standing challenges of racism and the legacy of colonialism, rooted in principles of human rights. The advancement of these recommendations shall be grounded in the Declaration on the Rights of Indigenous Peoples Act. I'll be directing the Ministry of Health to fully engage in working on all recommendations in the report with our Indigenous governance partners. At the core of our response will be action. Action to implement the recommendations. Action to ensure that Indigenous leaders are fully included in any response. Action to see that change happens. I'm pleased to announce that Don Thomas, currently the Vice President of Indigenous Health and Diversity, Equity and Inclusion at the Vancouver Island Health Authority, will be seconded as Acting Associate Deputy Minister to lead this work. Over the coming days, we will be reaching out to leaders who bring First Nations, Métis, Indigenous, and health system perspective to form a task force to support Don Thomas and implement the urgent change that is required, consistent with the recommendations in the report. The task force will be accountable for regular reporting on the progress, updates, and advancement as we move to implement a comprehensive system-wide approach to these recommendations. I have also asked that both the 1-800 number and email address that have been used throughout the review to bring forward instances of racist behavior be continued in the coming months until we get action firmly underway on an effective complaint process. Dr. Turpel-Lafont has agreed to stay engaged to support my Deputy Minister Stephen Brown and the new Associate Deputy role to advance this work. I am, again, very grateful to Dr. Turpel-Lafont and her entire team, and especially, and most especially, to every person who shared their stories, so often private and painful to recount and retell. I thank you all for your courage and commitment to help all of us make real, meaningful change. I look forward to working with Indigenous leadership, health professionals, colleagues, and partners to further advance these recommendations. As the Minister of Health, I want to direct the change that will give people in BC the confidence that when they arrive at the doors of our healthcare system, they will be seen as they are without bias and prejudice, and with care and respect. To address systemic racism in our healthcare system and root out its deeply damaging effects, every single one of us must ensure the necessary changes to our behaviors and beliefs. Only then can we find lasting and meaningful equity and reconciliation. Today, the vision for change may be mine to share, maybe Dr. Turpel-Lafont's to share, but the strength is for all of us to make it grow. And the reality is, it is for all of us. It is ours to make. Thank you very much. I want to welcome your questions. I want to welcome Dr. Turpel-Lafont back to the microphone.
Thank you, Minister. As a reminder to everybody on the phone, please press *1 to enter the queue. You are limited to one question and one follow-up. I would also ask that you please take your phones off mute. You will not be audible until your name is called. First question is from Rob Buffum, CTV Vancouver Island.
Oh, hi, good morning. Thank you for taking my question. I guess my first question is, you've said in the report and today as well that you did not find widespread evidence of the alleged blood alcohol game, it was being called. But I'm wondering, there was reports this summer that specifically Saanich Peninsula Hospital was one location where that was taking place, targeting Indigenous people. Can you comment on whether that is the case?
Right. I think it's important for me to note that I didn't find an organized Price is Right game. I did find that there were activities happening in places and during certain episodes and times where there were what I would consider to be guessing games or treatment that would not be consistent with what we are suggesting is required for quality. And in those different places, there has been some work underway over the last number of months. I think in particular, I'm not here to give you an assessment of the quality at hospital by hospital. Certainly you're going to see when I release the data report the kind of information that's there. I do think, though, that hospital as one hospital is a place where there's been significant work underway over the last number of months. And I certainly do check in with the First Nations leadership local to the Saanich Peninsula Hospital, and they tell me that there has been some significant change in terms of the quality of service and the relationship building. So that's one of the, I guess, unintended but important consequences of this review. So I can't go into a lot of detail hospital by hospital. I did a confidential review and received information on a confidential basis, but I can say that there are a number of places in British Columbia where there have been active processes underway for the last 4 months to bring forward issues, discuss them, and attempt to do a reset. And I think that's a very positive development.
Do you have a follow-up, Rob?
I do. I'm wondering about in the report, as I understand it, 13% of healthcare workers in the survey had made racist comments. I'm wondering if you're able to kind of expand on that a little bit, as well as it's my understanding that people, although the report focused on Indigenous and Métis people, there was other people of color who were also interviewed for the report. I'm wondering if you can comment on if there was any findings relating to people who were, the subject of racism, who are not Indigenous or Métis.
Yes, I think one of the difficult things that we found was even when we were engaging those more than 5,000 healthcare workers and surveying, they identified perhaps an encounter of discrimination at the point of care that they had seen or heard. Yet for 500, they also repeated what I would call to be an implicit prejudice against Indigenous people, and more than implicit, explicit. So they may have identified very well and accurately when abusive engagement happened with stereotype behavior, with personal racism directed at a patient. Yet in the survey, they would also have said, you know, they should get over it. They should stop being victims. It's their fault. So there was a lot of comments, more than 500 comments, and throughout the process of the review, I received a lot of racism. Emails to the team, descriptions that took very, like, instead of saying all lives matter, stop looking at anybody. So really discounting the importance of addressing the treatment of Indigenous people. And at times, I did receive issues or allegations that affect peoples other than Indigenous peoples. So Black, people of color in British Columbia. I was only looking at Indigenous specific racism, but however, there were many comments that suggest to me that there are still attitudes and opinions that are circulating in health professions that even though they may be able to identify an abusive interaction that involves a stereotype and poor treatment, they repeated many of those key stereotypes as well. And that was a concern to me, and that tells me that we need more work to be done, and that in terms of privilege, all healthcare workers are working very hard at this time, but some of those attitudes and opinions repeat the kind of prejudice that results in poor treatment in their workplaces and at the point of care. So that has to be addressed. I was surprised it was as extensive as it is, but it gives me greater resolve in the recommendations, in particular where I talk about speak up culture and rooting this out and dealing with it. It gives us a better understanding of what it is, what are the opinions that are circulating that are racist and prejudicial that we need to bring forward. And to some extent, it does mirror other things I've seen, like in particular when issues of residential school were first being brought out in Canada and in British Columbia. There was a strong backlash of like, just get over it, we're not going to talk about that anymore, we don't want to deal with it, too bad, that's in the past. Not understanding the continuing impacts that these behaviors and thoughts have and the barrier that they create to safe, culturally safe service and communication. So I just noted it, and I would say that it was a bit shocking that it was that high in British Columbia. I particularly am concerned about Indigenous people who work in the healthcare system, who have been have experienced direct personal racism. It's important that they're safe today, and I certainly wouldn't want anyone in the healthcare system to say, hey, did you see that report? Let's start talking about it with you right away. Because how to talk about these things, how to engage respectfully, we need to make sure First Nations and Métis healthcare workers in the system are safe and that we deliver services to patients, but we also have a collegial environment that is respectful. And some of the Indigenous nurses and staff in the system and doctors even have themselves experienced racism. And some of it has been career-limiting racism. And that's something that needs to be acknowledged and needs to be worked on. So the kind of 500 plus comments based on intolerance and racism, that was concerning. And if I was in that workplace today, seeing that and feeling that, I could see how it would affect things. So we do need to make those changes. Thank you.
Next question is from Richard Zussman, Global News.
Mary Ellen, are you satisfied with the response that we just heard from Minister Dix and from the province, and are you satisfied with the timelines that they're working on?
Yes, I'm very pleased. As I said, I'm just very grateful that Minister Dix commissioned sort of like the first ever complete review of racism against Indigenous people in a healthcare system. This was an enormous sort of undertaking. I'm glad to have been able to provide this back to him. I'm also very grateful in my conversations with him and his senior officials that and what I heard today was that there's a commitment to not only accept the report, but to work what are the near-term measures today. And in fact, I was very pleased to just hear Minister Dix give a very bold apology. And I do feel that he has to set the tone, and I'm grateful that he has set the tone. I do think that there needs to be apology, there needs to be engagement with Indigenous people at the point of care. And when you have a hospital in a local First Nation or Métis community, I'd like to see very local engagement to be able to begin to root that out. But I'm very grateful that he has set the tone. And I'm also very grateful that he said he will bring it back to his colleagues in the government of British Columbia at that level, because for sure, addressing the racism we've seen here is about the health system doing its part. but it touches on other systems. And I did have a chance on the weekend to speak to the new Minister of Education and send a letter to the Minister of Education, because cases did come forward during this review that touch upon how Indigenous people are treated in the K-12 system when they get healthcare services there. So I'm grateful for the fact that he will bring the issue for a broader discussion, and he has indicated some strong leadership. And of course I am committed to support him and support his ministry, and I've worked closely over these last 4 months with all the health colleges, the health authorities and others, and had some, I would say, difficult conversations at times, and conversations about addressing racism. And I think we're all in a very good place today. But I know Minister Dix has carriage of the system of healthcare, but there's a lot of partners. And for his part, I'm really grateful for the apology. It's up to Indigenous people whether they, can accept that apology today. And no one is here to say to people how apology should be taken. But apology has a very powerful thing, because it acknowledges something and it begins a process. And I think that the beginning of this process is much more positive than it could have been. And no doubt there are other places in Canada where there's not the kind of understanding and acceptance that we have in British Columbia, which makes me feel encouraged about our ability to work together and address this in the next matter of sort of days and months.
Richard, do you have a follow-up?
Considering, Mary Ellen, how deep-rooted this racism is based on your findings in the report, it's clearly not a simple fix. Is there optimism that things can be fixed, considering there will be people, working in the workplace that have been doing things a certain way for a long time? Is training enough to address that? I know this is a big question, but, how do we break down those long-standing barriers that have existed?
Right. Well, I think I think there are mechanisms to do that, like just very basic things like defining quality of care as meaning having the experience of care. Quality itself means not having racism and discrimination. And so we have our Patient Quality Care Act. It doesn't have a definition of quality that includes that. That's something that could be changed quite quickly, and that activates a very clear understanding that what we see as quality in healthcare means you are free of all forms of discrimination. And if you have a concern about it, you can go to the patient quality process and be heard. Obviously, it's important that when people are treated with discrimination or racism, that they also have a real remedy and a way to bring it forward. We need to strengthen that, but we need to define quality in a way to say very clearly that it includes having healthcare services being delivered free from all forms of racism and discrimination against Indigenous people. So yes, there are issues in society without a doubt, but in healthcare, it's very significant. And as I've said in this report, it isn't just about negative personal interactions. Literally, the report includes multiple comments that I heard of people saying, I would rather die and not get the needed healthcare treatment than go back into that system and get it. And that is a very significant problem. We need to change that. So not only is there quality, but it's a safe environment. And it's a welcoming environment. And certainly my message today to Indigenous people is if you think you need health care, please get it. If you're concerned about how you're treated, the Minister has allowed us to continue our 1-800 number and our email line. We want you to speak up and speak out. We want everyone in the system to speak up and speak out. And we want non-Indigenous people to be informed about what the kind of racism is that's operating in the healthcare system, what are the stereotypes, and we can start to dismantle those. So I do feel very encouraged. I know it is deeply rooted, but we have to begin somewhere. And today is the beginning. And I think that we will need to measure where we get. But today is a very important beginning, and so I do feel encouraged by that.
Justine Hunter, Globe and Mail.
And I'm wondering how you go about doing this. How will you be able to determine that this is actually making the changes that you're calling for here?
Well, there's a number of things you can do, and I was fortunate in my team to have people like Dr. Perry Kendall. So the survey instrument we designed, it has a longitudinal. We could run it again and see how we're doing in a period of time. Are we seeing less of those abusive interactions? And so I think the 24 recommendations, some of them really are to get at how do you change system, how do you root out racism, how do you ensure that the goodwill that's being expressed, at least to me, to address it can be marshaled into on-the-ground change? So I feel very strongly that there are specific details, and again, I'm not going to go through all of the recommendations. A lot of them have to do with today, acknowledging, validating, and encouraging a speak-up culture. Going forward, it is going to require some hard work in the healthcare system. As I said, applying the Public Interest Disclosure Act to the healthcare sector is something that I think is very important and can be done quite quickly. So we can begin to get that out and go forward. So I feel that prejudicial attitudes are attitudes that can be dismantled. Some of it is implicit bias. It might be more explicit. There are some clear and intentional racism that is functioning in the healthcare system. But I think we need to begin that process of taking it apart, identifying it, and being so clear that it is not an effective strategy. It has no place in the healthcare system, but it doesn't actually serve the needs at the point of care of supporting and doing the work that has to be done. It doesn't belong in the healthcare system.
Do you have a follow-up, Justine?
Minister Dix, I'm wondering if you can specifically respond to the finding that 13% of the healthcare workers who filled in the survey themselves made racist remarks in that. Where do you begin to deal with that?
I think you do that by starting the work. I'm very honored that Don Thomas, who has done extraordinary work, Dr. Turpel-Lafont referred to the situation at Saanich Peninsula Hospital. A lot of the change has been inspired by the work of Don Thomas as Vice President of Vancouver Island Health Authority. She hasn't been in that position a long time, but she's now taking on this challenge on our behalf, and we have to simply start that process. So some of it involves changes to systems, and you'll see those recommended in this report. And some of it involves ongoing work with individuals. I think that the existing education and other efforts we have had in place, many of them have done well, but they're not sufficiently taken up or sufficiently in place to make the change that we need at a point of care level. I think it's really important to have effective complaints processes, and the kinds of recommendations around complaints processes in the report by someone who I think is an expert in giving the public voice in system decisions. As the child representative, Dr. Turpel-Lafont is exceptional in that regard. But I think it's really important as well that every day people have confidence that they can come in and get care. And I want to say to people that it's all of our responsibility to make sure people have that confidence. And that really is the key moment in this report, how people will feel about getting care, how we can address things like people leaving hospitals because they want to get away from care, even when it's recommended that they stay and get care. Those are fundamental. We have to focus on that. And I profoundly believe change is possible in these times. So yes, there are people who harbor beliefs, and I also believe, though, that the people who go into care fundamentally believe in care and believe in helping others, and that's a pretty strong basis to develop change as well. So we have to acknowledge the situation exists. That's what we're doing today. We've done that in the past, and we've had some success in the past, but now we have to do something far broader and more systemic, because we've asked for this review. The review has shown facts such as the one you've laid out, Justine, and we have to act on that. And is it going to be easy? Of course it's not going to be easy, but the way to do that is to start, and we've been doing that over a number of months, preparing some initiatives, but now we have to make sure those initiatives both meet the test of Indigenous partners, and that's an important part of consultation, but we have we're putting the task force in place and the people in place to make change happen, not great statements about accepting all the recommendations, but action today. Dr. Turpel-Lafont will be part of that action. Our whole team will be part of that action. It'll be led by an outstanding British Columbian, Don Thomas, and I think we're going to have some success. We're going to solve every problem by tomorrow, or by next week, or maybe even by next year. But the way to start to address these things is to give yourself tests, and then to set a standard for success, and then start to work to do that. And I think that'll make a big difference. And the person I want it to make a difference for most is the person who needs health care in BC and is reluctant to get it now. That's the test that we have to set for ourselves. That's the most important test, and that's the test that I am setting for myself as Minister of Health and the entire healthcare system.
Next question is from Tina House, APTN.
Yes, would you go as far as maybe implementing healthcare workers to wear body cams to know that they are being monitored to ensure that they're professional at all times with everybody that they deal with, in particular with Indigenous peoples?
Just from my viewpoint, I mean, when we looked at it, we didn't think that that was the place that we're in. I think the fostering of speak-up culture is really important. I think that we did find some really challenging situations where Indigenous people were not having good encounters with hospital security, or I did report on some cases where Indigenous people end up having a night in jail instead of being in the hospital and getting their health needs met. In those really challenging areas that I found cases and I report on, that's sort of where the justice system and security intersects with healthcare. In those areas, maybe I would have a bit of a different opinion because I am a bit concerned about some of those issues and how profiling happens. What's really important is that no matter what kind of emergency services an Indigenous person calls for, they get care. And if they have a presenting health issue, it gets treated as a health issue. And I know in the report I tell the story about Corporal Sutton, and I name him in particular and grateful to him and his family, where he attended at the hospital and ended up being in a negative interaction, to say the least, with security, ended up being committed into the mental health side when actually he had a physical condition, a hole in his esophagus. And I was grateful for the Canadian Armed Forces medical team for intervening as well and taking his health care back under their control and getting him out. And so there was a physical altercation there, and he's a young, rising superstar for Indigenous people in the Canadian Armed Forces, a wonderful family from Stuk, a wonderful individual who's in his 20s. Someone like him, my message to him and his family is, please don't avoid care because you may need it because you have a health condition. And please, in security and in policing, do not have a negative interaction with Indigenous people that are seeking care. And please read about his case. Please read the cases in this report to understand that what you see and what you decide, in part because you have a preset view or a bias, is not appropriate, because this is about the point of healthcare. And in healthcare, we need to deal with the health of the individual. There's no room for the bias and the prejudice. And when mistakes get made, like they were with Corporal Sutton, they should be fixed quickly. He shouldn't be in a psychiatric unit for days. Or in fact, they told me at first he might be there for 6 or 7 weeks before he could be removed because they couldn't get a response. That was unacceptable. He was removed, he's at home, but he may need health care again. So someone like him, a young person, he has his whole life ahead of him. He may need health care over the years. I want to make sure he gets that health care and doesn't show up at an emergency room, meets security, is engaged in a physical altercation, and ends up not getting that health care. And I do report on many cases like that. We want that to end. Is body cameras the answer? No, body camera is not the answer. That's a tool that might be used as a last resort if we can't make progress. But at this point, I'm confident we can make progress. And one of the reasons why I'm so grateful and told these stories is to show stories of what's happened in healthcare in British Columbia so that we can learn from them, take them apart, and not make those mistakes again.
Do you have a follow-up, Tina?
Yes. Would you also recommend more severe punishment for an employee in the healthcare system that is shown to continually be racist towards Indigenous peoples?
Well, I was really grateful when I heard Minister Dix this morning talk about a condition of having privileges in hospitals is making sure that you can deliver on that privilege in a way that doesn't involve racism and discrimination. So that's a decision, and I've engaged directly with health authorities, and so I'm really glad to hear Minister Dix set that out so clearly. There are colleges and regulatory bodies. I've talked to all of those colleges and regulatory bodies about this. I want to be really clear. Quality includes quality health care. The definition means delivering care without racism, without prejudice. Privileges should only be exercised by people who can do that, can meet that. There should be no privilege for people who perpetuate abusive interactions toward Indigenous people that are clearly racist. There should be no protection for that. It wasn't my job to impose remedies. I got a lot of information, confidential information through the system because I gave protection to people to come forward. Those people are very afraid about consequences. So we need to shift the whole system. But privileges are for people who can meet the standard. And I'd say it again, you know, a year ago, BC passed the Declaration on the Rights of Indigenous People Act. It requires for all the laws and policies of BC to come in alignment with the UN Declaration, which has a very clear article, Article 24, that says Indigenous people must be able to access health services without discrimination. So all of these rules and principles have to come back in alignment with this. We're heading in that direction, but it's going to mean taking it down specifically. And well, I'm extremely happy to hear from Minister Dix today and his sense of sort of atonement and starting to grapple with this. You know, it will be very important for me to hear from health authorities. I want to hear what the boards of the health authorities have to say today in the future about what they will learn and what I've been talking to them about. So I want to see that in the College of Nurses, the BC Union of Nurses. I want to see it in physicians. I want to see it across the board around how will they engage, what do they think. So this isn't just about like body cameras and really extreme measures. This is about whether we have the conditions to change. I think we have the conditions to change, but time will tell. And it's going to take a lot of people stepping up and acknowledging, and a lot of people recognizing that certain behaviors that have been allowed and acceptable are not going to be acceptable. And that's going to take changes. And those changes may be difficult for some people, but leadership has to hold people to account.
We have time for one more question, but before we go there, I would like to call on Bailey Morales from Indigenous. She didn't get an opportunity to ask her follow-up in the technical briefing. Go ahead, Bailey.
Hi. Yeah, I was just going to ask a follow-up. Again, we were speaking about the protections for whistleblowers, and I'm wondering how you would recommend the system remedy issues of consent. So, for example, Indigenous people have reported issues of having like a paternalistic relationship with health authorities, and I'm wondering how you'd recommend people go about reporting those problems. So issues of, you know, like you said, with Corporal Sutton being put in the wrong type of care, or children being taken from the health system, and issues such as that. I know this is kind of vague, but there's so many examples.
Right, and I I outline in specific recommendations things I think will be very important. So recommendation 2, I actually identify a number of pieces of legislation that I think we need to revisit and strengthen, so that it's really clear that the Health Professions Act, the Hospital Act, health authorities, and especially Patient Care Quality Review Board Act, that we make the changes to be clear that you cannot deliver health services in a way that promotes racist ideas and experiences. So there's a number of very specific recommendations, but on Speak Up culture and the need for the Public Interest Disclosure Act to apply to health workers, that is something I've spoken with the BC Ombudsman a fair amount about around the preparation of this report, and talked about that, about how does it work, and if that act is enforced for healthcare workers, they can anonymously report things as well. So patients need to have a process to go through, staff needs to have a process where they can report, they can anonymously report, they can contact the Ombudsman and others to be able to begin a process to root that out. So I see both sides of it. I see healthcare workers need to have safe reporting. We need to stop that sort of fear of recrimination. And patients need to be able to address issues, whether it's quality of care, whether it's racist commentary, or abusive interactions which do affect quality of care, that can be dealt with. Not everyone wants to bring a complaint forward, and the complaints processes are difficult, and you'll see I've made a number of recommendations about that. But I do think we want to strengthen that these voices are heard, not only leading up to today, but going forward.
For everybody listening today, you can find the long and short report at the bottom of the news release. Our last question today is from Dominique Levesque, CBC Radio Canada. Dominique, are you there? Go ahead.
Dominique, your line is open.
Yes. Do you hear me now?
Yes.
Okay. For Minister Dix, in French, please. Je voudrais que vous nous donniez d'abord vos réactions aux conclusions de ce rapport qui dit qu'il y a vraiment du racisme systémique dans le système de santé de la province.
Premièrement, je dirais que cette question du racisme dans le système de santé canadien, c'est une question importante ici en Colombie-Britannique et je pense partout au Canada. Je pense que les leçons de...
This show has been produced by Depictions Media. Please contact us at depictions.media for more information.